What's dry needling? It's not acupuncture. The needle helps stimulate the tissue to relax it. It's very safe. I want to apply it in the right manner. What's that feel like?
It really doesn't feel like anything.
So, India, this is your second visit with us.
Yeah.
So you came in, you had daily headaches, you had neck pain, you had low back pain, you were coming in with a couple different problems. You were in some accidents before this, right?
Mm-hmm.
Tell me a little bit about the car accidents you experienced.
I had a car accident on my side. I experienced whiplash.
Mm-hmm.
I was very young, but I did go to physical therapy to help my my neck pains, and I had neck popping. Like I could turn my neck and it would pop.
You feel a release or an audible in your neck when you would move it around?
Yeah.
Gotcha. And so that was when you were younger. And then what brought you back into the office? I know you're complaining of those areas, but really what kind of motivated you to come in and get care?
Really just just making sure I am comfortable.
Mm-hmm.
I was playing sports as well, so having concussions on top of the accident, it didn't help. So, and I don't think I have the best sleeping positions either. So, just making sure that my back and my neck is aligned.
Okay.
And that I feel comfortable.
Right, just for relief, feeling better, better health in the neck. Dealing with daily headaches is not something that you were trying to you were managing it on your own. It just wasn't resolving.
Yeah,
right?
It wasn't.
What would help the headaches outside of here besides rest or sleep? Is there anything else that gave you relief to your headaches?
Maybe certain stretching positions.
Okay.
But really just rest and no light, somewhere in the dark. Maybe like in my room with the lights off.
Yeah, so a lot of noise is light, like stressful environments would increase the likelihood of the headaches.
Yeah.
So when you came in, you filled out some questionnaires, we went through an exam, we treated you for the first time. Had you been to a chiropractor before coming in to see us?
Yes.
And what was your experience like with them?
I had a very good experience with them as well.
Nice.
My chiropractor mostly focused on massage therapy.
Okay.
So,
That's right. You came in, you're like, I want someone that does fascial release as
Yeah.
well as does the adjustments. That was
Mhm.
something that was you were looking for in a chiropractor, right?
yeah, actually, I was looking for multiple chiropractors
Gotcha.
who focused on both of those. So, this was a good spot.
Right. I'm glad you found us, and
Yeah.
I hope we continue to help you on your journey, right? And that's a good thing. Like, not a lot of people kind of put in that extra step, if you will, of
Right.
looking and sifting through the different techniques that a chiropractor can do. So you already had an experience. You're like, oh, this guy does, adjustments, and he does soft tissue work for me, and you wanted to recreate that experience for yourself, right?
Mm-hmm.
Gotcha. And so you came in, you got dry needling for the first time with us?
Yes.
Gotcha. What was it like when you got it done?
Is that the stickies?
Yeah, exactly. Well, no,
no.
So that's okay. No, you're okay, because a lot of people think of this treatment as acupuncture. It's dry needling, so it's using a needle to release some of the tension in the neck and the upper back. So that was the first thing you got last time after our exam. And then it's called TENS units, or stim pads, right?
Okay.
And so the stim, or the vibration that you get on your neck and your upper back, transcutaneous TENS, electromusculostimulation TENS. Transcutaneous electromusculostimulation. I cannot believe I pulled that out of my head. So that's what you get over there.
Mm-hmm.
And then you get the adjustment in the other room. So you got dry needling here for the first time. How was that experience for you overall?
That experience was very relaxing.
Nice.
I felt like, after you put the needles in my neck, after a while, I felt different areas start to relax.
Cool.
In a way. I did feel certain areas more than others, but after a while it was really relaxing.
Okay, nice. And then you got some heat, and you got adjusted. How have you been since your first visit, and what have your headaches been like?
My headaches definitely have decreased. Since that visit, I haven't woke up with many back pains.
Good.
Yeah, sometimes I get back pains here and there, but they definitely decreased since my first visit.
Good, and it's a start. So we kind of talked a little bit about what we like to focus on with you when it comes to the transitions of care. At the beginning, we need to understand what's going on, right? You had some muscular strain, you had some postural tension, you have a history of the whiplash and playing sports and the concussion. So he kind of came in with a problem that we call chronic, right?
Yeah.
And with chronic problems, the first thing we want to do is, if we kind of eliminate one box, is eliminate the pain that you're experiencing, right? So that's a process, and there's certain things that we do to eliminate the pain. We start with more, let's call it passive therapy. So where you're not doing anything, right? You're relaxing. I'm doing all the work for you, on you, which we're grateful that we get to do that, right?
Mm-hmm.
And it's what you need right now. And now when you start to feel better, we're going to introduce you to some more active therapies, right?
Mm-hmm.
And that's going to build up some mobility and then also give you some things to do outside of it.
Okay.
Cool?
Mm-hmm.
Get you strong.
Yeah.
Let's go. And yeah, I love it. And so we're going to work on your neck again today in the room. You're going to see me work on India and do an adjustment on her neck and her upper back. I'm going to work on her jaw as well a little bit and just show you how I deal with these tension style headaches that come from the neck. Yeah, enjoy the journey. I'm just going to treat her for now and hang with India because that's what we're doing today. Cool?
Mm-hmm.
All right. We got that MRI from Johns Hopkins too, so we got that added to your record.
Okay.
When you're ready, you can get comfortable. So when India came in, she had reduced rotation to the right side of her neck. She had, it's called maximal cervical compression test. That was positive on both sides. She had discomfort when she would load these joints in extension. She didn't have any muscle weakness, and we went over palpation as well as we finished out that cervical spine and the range of motion. We talked about what she wants to accomplish when it comes to feeling better too. We talked about what her goals are with her health overall. And we'll go over those in just a second. So let's try needling. It's not acupuncture. So ancient, let's call it traditional Chinese medicine, right, is a term to describe certain health approach. And they can use herbs, they can use needling in the form of acupuncture, and that's not what we're doing today. So with dry needling, I'm going to focus on India's traps, so the muscles that sit here. She's got a little point of tension on that muscle tissue that's contributing to her neck pain. The needle helps stimulate the tissue to relax it, to bring good blood flow to the area. It's very safe. I'm going to apply it in the right manner. A little tense here, okay, India? Breathe. Right there. So you can kind of see that muscle cause a little jump in the beginning. Did you feel that, India?
Mm-hmm.
What's that feel like?
It really doesn't feel like anything.
Okay.
Like
a deep pressure?
Yes.
That's quick and then releases quickly?
Very quick.
That's a muscle twitch, that's all. Just like that. So working with those upper trap fibers. And then I'm going to go to some of those areas in the neck where she's got that cervical tension that's contributing towards those headaches, that neck pain. And really, I love dry needling. It's a very effective and quick treatment for a lot of these problems, especially when we combine it with a lot of different therapies. Okay. And are you doing well so far?
Mm-hmm.
Good. Let me know if you need anything. No pressure. Paraspinal muscles right around that upper thoracic spine and lower cervical spine. And does it hurt?
No.
I know you're thinking that out there. That looks like it hurts. It's a really, really small, tiny needle, and its job is to stimulate the tissue. It's not trying to damage the tissue in any way. So we're trying to make a deep stimulation. So getting to those deep muscle lakes, the muscle lakes that we can't push through the skin to get to, this allows us to make a little bit of a quicker change in tissue. In a couple ways. It relaxes the tissue, blood flow to the tissue increases. There's certain pain mediators that occur in that tissue to help manage discomfort or chronic pain. Relax. A little tighter right here. Good job, India. Breathe. I use this box breathing. You can practice it at home. India, breathe in for 4 seconds. Hold for 4. Exhale for 4. Hold for 4. Just kind of work that breath while you're laying here. Just keep relaxing your shoulders, and like you talked about, after a little while you'll start to feel everything let go. India, you relax? You comfortable?
Mm-hmm.
Cool. Alright, we'll be back in just a minute, okay?